has been referred to Vernon Pediatrics for concerns around ADHD, or Attention Deficit Hyperactivity Disorder. This is a common concern in children, as up to 6 to 7% of kids have ADHD, and many times there is a family history of people who struggle with attention, focus, hyperactivity, or impulse control. Now, to be clear, all children and adults have some features of ADHD at some point and in some environments. However, if your child is struggling in either their classroom setting or at home or out on the sports field, and it's causing dysfunction to their social relationships, their academic functioning, or their ability to maximize their own potential, that's when we want to do something about it. To make the diagnosis of ADHD, we will send questionnaires that we ask you and the child's teacher to fill out. And certainly if there are other coaches or other places where you feel that their feedback might be helpful, we encourage you to bring that feedback to your appointment. Unfortunately, the wait time for assessment for ADHD can be quite long, and we certainly don't want you to wait for the appointment before you implement behavioral strategies at home. There are excellent programs through Kelty Mental Health, including Rolling with ADHD, which is a parent webinar that you can do at home to implement strategies that might help your child. We also encourage you to continue to work with your teacher to make sure that your child is being best supported in their school environment. If your child comes to our consultation and the feedback from you and from other settings does show that their symptoms of ADHD are more severe or persistent than some of their peers, then we will offer a medication trial using stimulant medications. These are very safe medications that have been used for many years, and we have good data on how they help to improve children's overall success, both at home and in their school environments. These medications do have some side effects, including appetite suppression, and this will be discussed with your pediatrician at the clinic appointment. We will encourage you to increase the calories at some of your child's other meals if you are finding that they're not able to eat well with the meal that they have. Other than appetite suppression, these medications are generally tolerated very well, and we do work with you to help figure out a dose and the type of medication that will work the best. Outside of medications, there are other very important things that you can do as a family. The most important is to help your child get a good sleep. We do have some sleep resources on our website, but we ask you to please try to aim for 10 to 12 hours of sleep per night in your child, and that the sleep is well-rested sleep. This means screens should be turned off at least an hour before bedtime, and there should be no screens first thing in the morning. If you need to, melatonin is also an option that can be used to help your child sleep well. We also encourage children to get daily activity of at least 60 minutes, and we encourage them to spend some time doing non-stimulating activities, including things like reading, walking, playing with friends, and board games. Once an ADHD diagnosis has been made, we will provide you with a letter for your school so that further supports can be put in place to help your child. We do know that early treatment of ADHD can really help the long-term outcome of your child with both their academic functioning, their relationships, and putting them at lower risk of some impulsive behaviors as teenagers. It is important to note that for many children that we are assessing for ADHD, they may also have a learning disorder. We do not do learning disorder assessments through the Vernon Pediatric Clinic. This is done through the psychologist at your school or through something called a psychoeducational assessment that can be arranged privately. If you think that your child has difficulties with learning, please talk to your school or visit our website for further information around how you can arrange a learning assessment. We hope that this helps to explain what the process is for ADHD evaluation and treatment through our clinic, and please visit our website for excellent resources and things that you can do while you are waiting.